You can write your own, some roles on this. You can actually have this one in 2 pages. In 1 page for water soluble and some other fat soluble, and write your own comments on that. And I'm sure that will be enough for your course. So here you see some for water soluble. We have a B complex protein vitamins. Some of them are B complex, like B1, B2, B3, and B9, B12. A lot of them we have. And some other water solubles are non-B complex. The most famous one is vitamin C. And for the fat soluble, you are already familiar with this vitamin A, D, K, and E. For the B complex, some of them, the B vitamins, some of them are involved in energy release. Yes, like B1, B2, B3, biotin, and pantothenic acid. They are belongs to this energy releasing pathway. And some others are involved in hematopoietic cell dividing. Which ones? B12, folic acids. For pregnant women, this folic acid is essential because cells in their womb are dividing and they need the folic acid. Deficiency of folic acid causes some neuronal defects or tube making defects. And for the other forms of the vitamins, like vitamin B6 group, pyridoxal, pyridoxamine, or pyridoxamine, all of them are derivatives of B6 vitamins. Let's see some of diseases or some physiological roles of these vitamins. And you can compare both of them, water solubles and fat solubles, what they do and how they are. For example, for the vitamin, for these water soluble vitamins, we can store them. We have just minimum level of them. So because of that, in daily, meals, we need to take those vitamins. And for the fat solubles, we can store them. If we actually don't consume them for a while, we will not face the deficiency of them. But there are some disadvantages in being soluble and being fat. The advantages of the solubility is that they are water soluble, but we can't store them. When you can't store them, so you need daily needs that, or weekly needs those things, and you will not face the diseases in storage form. But if you consume, like let's say, fat soluble vitamin, can you consume more vitamin A or vitamin D? They show toxicity. Yeah, we have a toxicity related to these vitamins, and we have to take them as a optimum level of dose. We can't actually get all. But about these ones, no matter how much you get, because they are water soluble and they are excreted in urinary pieces. However, in some cases they might show some signs. For example, if you get more vitamin C, it is good. But in some cases, it might show some toxicity. We have this here, specifically for this one. So, but for these ones, you can't actually, you will not face with their deficiency in short term, but if you consume more, what happens? They show some toxicity. So, I'm gonna, skip these things. They are essential to. For all enzymes, we know for the coenzymes are essential parts of these proteins. Do you expect some recommendation or suggestion from me or not?
There was also
give you some suggestion. then actually we say one, I know, we respect the class, but I wish we had another door at the end of the class. When you come to the class, without any distraction, you can actually continue them. But for your actually classmates and your position, try to be on time, in time. Which one do you prefer? On time or in time?
On time.
Yeah, on time is good. Yeah, thank you so much. So, yeah, we know these vitamins are essential for the enzyme as a coenzyme part of that. So, let's start with B complex one. We know a lot of vitamins in B complex. One of them is B1, or another name is called theanine, or thiamine. It's the best vitamin in what sources? Whole grain and unpolished rice. What does it say? Unpolished rice. You have polished rice? What are those polished grains? Shell out. So we, the meat industry, they remove, outside membrane of this rice and wheat. Yeah, exactly. We produce white flour and say that's great. I'm gonna cook with this flour, but it's not healthy. Next time we are gonna get whole grain because the shell contains vitamins and creatures or in the nature everything's all are together. Inside of that we have a carbohydrates, but outside of that we have what? Vitamins. For what? Because that carbohydrate goes to where? In energy metabolism rate, and this vitamin is essential for that energy pathway. You will see that. I just mentioned about some reaction, but I'm not going to ask what kind of reaction these coenzymes catalyze. Then, see, what kind of bread is that? It's not white.
Brown.
Yeah, it's brown one. If you get the white one, there isn't vitamin D on it. And the structure is like this. Again, you are not supposed to memorize this structure and details of that. You are not chemists. This is the thiamine pyrophosphate, true phosphate of that. You might see in the books thiamine pyrophosphate. Why we have a pyrophosphate? Pyrophosphate is a sign of something is ready to do something. When you give phosphate to something, it's a kind of boosting energy for starting, running or doing something. In many places, you will see some of these vitamins or compounds in metabolism. They have 2-phosphate. That 2-phosphate is giving enough energy to them. Let's do something. So that is saying. And they are involved in metabolism and decarboxylation. They are involved in removing carboxylates. That's it. I'm not going to see this is a metabolism pathway. Again, you are not supposed to memorize this. Just knowing this decarboxylation is enough. And this is a Krebs cycle for producing the energy. This is a glycolysis. All of these pathways are involved. See, glycolysis and CCA, that is involved in using thiamine pyrophosphate or vitamin B1. And also it is involved oxidative phosphorylation. Oxidative phosphorylation is the last steps of the energy production. You are going to study those things. And you can put a cross on it. I'm going to skip this one because it is talking about the metabolism, but you haven't started metabolism. And we just know which is involved in the carbohydrate metabolism and the carboxylation. However, some amino acids also use this one. And again, this one. So, what are the diseases? Inadequate of this deficiency of the thiamine. Most of the time, inadequate diet. It comes from this inadequate diet. And second one, you will see a lot in patient alcoholism, is thiamine pyrophosphate deficiency. And in pregnancy and lactation, increased carbohydrate intake. Some people actually even take more carbohydrates, specifically those kind that they are white flour and or polished rices. They face with insufficiency of fats, and in hyperthyroidism and fever, level is low. It goes down. Level of hyperthyroidism. What are the diseases? One of them is beriberi. Another, Korsakoff syndrome. It happens on alcoholism. And signs like this. Yeah, when you put the pressure part of the skin, it takes time to pass through normal situation. You will see for a while, at least for some seconds, there is a hole-like shape there. And again, you can escape this one because that is a metabolic pathways. You come back to this one when you have this slide for yourself in metabolism, but now it's not. Vitamin B2. Where you can find this vitamin B2? Can you give me some resources of that? The name is riboflavin. Yeah, you can have, but mainly we have you tried some, alcohol zero Delester brand in Iran?
Yeah.
Well, what is the color of the, bottles?
Which one? Not 0% alcohol.
0% alcohol. Delester. The brand name is Delester.
It's also on the
Green. Why? Why do you think? They actually color isn't, clear. They have riboflavin. Mainly they have a riboflavin B2, and riboflavin is sensitive to light. So those colors actually protect them from, destroying that structure. Riboflavin is in reduced form is essential for us. In oxidized form, it doesn't work. And you will see this is structure. This is a riboflavin, and light and can destroy opens the rings. So it is antioxidant, and it is involved in production FAD. You might hear FAD and FADH. See, FAD, also FMN. This is a flavin adenine dinucleotide. This is a mononucleotide of this flavin. This is we have mononucleotide, just mononucleotide, we use FMN and FAD. Both of them have this structure. See, differences between FMN. This is a one riboflavin structure, and we have another nucleotide here. See, because of that, this is called flavin adenine dinucleotide. So it is involved again in many pathways like B1 or termin. It is involved in metabolism, carbohydrate metabolism in many places. Amino acid oxidation, mitochondrial respiratory chain, citric acid cycle. It is involved in metabolism. Everywhere you can find this vitamin. And let's riboflavin deficiency. About the dietary deficiency, is it common? Because in many researches we have that. We can get that. But in some condition it happens. When it happens? In alcoholics, patient they have some phototherapy because that photons can digest this riboflavin, or long-term some therapies like chlorpheniramine or pregnancy and lactation. They are the main reasons for deficiency. What are the signs of the deficiency for B2 or riboflavin? We have some signs like pilositis, swollen palms, see, or cholecystitis, cracked lips, like here, or seborrheic dermatitis. I don't have dermatitis here. Yeah, it's a kind of, yeah, it's skin disease, exactly. Nervous system disorder. So for nervous system, that's a common sign, and you can't find an exact reason, but these reasons or these signs you can see without any forms. The next one is B3 or niacin. Another name. The structure is like that. It also involved in many resources. One of the only vitamins that we are able to synthesize two vitamins, vitamin D and niacin. We can synthesize this one. And it is synthesized from the tryptophan. Tryptophan is a one amino acid. It can be synthesized from that one. And so getting this amino acid helps to synthesizing niacin. But some people can synthesize this because of deficiency of what? B6. If you have B6 deficiency, you can synthesize that. Because it is involved. Tryptophan converted to niacin, which help by B6. And 16 milligram of tryptophan can produce 1 milligram of niacin. So, like FMN and FAD, we have another structure here, NAD. See, we have an NAD2 coenzyme. See, NAD is nicotine adenine dinucleotide or nicotine adenine dinucleotide phosphate, NAD and NADP. In a hydrogenated form, it is called NADH, and this one is called NADPH. In all reactions that we have a, oxidation reduction, oxidation phosphorylation. All of those reactions, this needs this vitamin. See, a lot of reactions converting glucose to pyruvate, pyruvate to lactate. We are not going to study these reactions. Wherever they are there. And niacin deficiency. What happens when we have a B6 deficiency? Because it is synthesized from tryptophan by this vitamin B6. Another disease is heart nut disease. It is related to tryptophan deficiency because part of this comes from the tryptophan. That disease is related. And pregnancy and lactation. In pregnancy and lactation, we need more of this vitamin. So moms, when they have a breastfeeding, they might face this one, or when they live in pregnancy, they might face this one. So, what are the signs, or what are the diseases related to this one? Yeah, exactly. See the three diseases. We call it dermatitis, dementia, diarrhea. This is the three signs of the main signs of the severe deficiency of this niacin.
It can lead to death.
Sorry?
Can lead to death.
Yeah, finally can. Yeah, these are so severe forms these days. It's so rare to see patients like this ones.
Niacin.
Yeah. One of the use of this niacin is for what? Hyperlipidemia. Some patients, they have hyperlipidemia, they can take this niacin as a drug. The drug level that is different from the normal physiological level that we get. So in high level, but they show some toxicity sometimes. So we need to be careful about that. Niacin is about those can show some cytotoxicity and we will not. We have several sources for niacin, fruits and fish and some vegetables. Pantothenic acid or B5. If you see, we don't have B4 here. We have pantothenic acid. Also, this one is involved in our energy pathway. And it is involved part of the coenzyme A in oxidation. explain this one. More just knowing that the number is B5, it is involved in energy pathways. And this is for synthesizing acetyl-CoA. You are going to see that it is essential part of the acetyl-CoA. And again, I will move to vitamin B6, or another name is pyridoxine. So pyridoxine is a compound like this. We have a phosphate forms of that, different forms of the pyridoxine, pyridoxal, pyridoxamine, different forms of this vitamin. And the main part for the phosphate form as a coenzyme is called PLP. Pyridoxal phosphate or PLP, one of the essential enzymes in what? In amino acid synthesizing. See, this one is essential for that synthesizing non-essential amino acid, transamination. Transfer amino group from one amino acid to another structure to synthesize new amino acid. Different forms of that, see? They are involved in different processes. We are not going to study this process. It's just giving you an idea where pathways they are involved. Just learn the diseases, main resources, not resources, you are not going to study resources. Main diseases, physiological role, and what can make them actually goes down or deficiency situation. Just knowing those things. And make general idea about their role. What is the daily role? Which part? Oxidation, energy production, or immune system. Which one is? Or vision. Which one is important? Or calcium, because they are the some of them are involved in these pathways. And see, transamination is the most important examples of that. The amination, decarboxylation, and condensing two things to each other. Roles of this vitamin. So, what is the vitamin B6 deficiency? Increases sensitivity to low concentration of the what? Estrogen, androgen, cortisol, and vitamin D. See? Patients, they have vitamin B6 deficiency, their sensitivity to some hormones goes up. And so that's essential. See, it is more complicated than the previous ones. You need to consider that. If someone actually shows some sensitivity to some of these hormones, that person should be analyzed for B6. And vitamin deficiency for this B6, sometimes we see some anemia or diseases related to what? Blood synthesizing. And some of those dermatitis is kind of common, like some other vitamins. And toxicity of vitamin B6, as we know, that is water soluble, but it is used in some situation and shows some toxicity in very high concentration. Because some patients actually get these ones. And biotin or B7. It is involved in carboxylation. Some of them were involved in decarboxylation. Some actually are involved in carboxylation and decarboxylation. So this one has a structure like this. It is involved in immune pathways, specifically in energy pathways. Vitamin B groups are involved in energy production and metabolism. And let's see, in carboxylation, I mentioned that in metabolism, and I'm going to deficiency. One of the deficiency related to overconsumption of the antibiotics is biotin deficiency. You should know that. Some people, they get more antibiotics, and they actually consume them without prescription. They are their own doctor, and they consume that. So they finally they can face with the biotin deficiency. What is this albumin? Who can actually eat albumin, white part of the eggs, without cooking them? Who's interested in it?
It's healthy,
It's healthy,
but not that. Doesn't taste good.
doesn't taste good. It's good. You have tried it.
Yeah.
How many times?
I put it in the milk, 3 eggs, a bottle of milk. It's in the radish ones.
So, have you ever faced some kind of tiredness in your muscles after consuming a lot of
Yes, but I cook it like 4 eggs, but it gives you really good energy with a long time that you don't need to eat food.
Yes, you are right, but you are susceptible. You are putting yourself in a situation you face with deficiency of this. Why? Why? Do you know why? There is a part avidin, there is a avidin in albumin, and if you don't cook that, it can bond to vitamin biotin in your body and doesn't let to be absorbed or destroy that one, and you will not have enough biotin, or you will face with the biotin deficiency. So one of the sources of the biotin deficiency are those actually people, they actually get albumin without cooking, because uncooked albumin has what? Avidin. Avidin bonds to the edge, this biotin, and remove it from function.
What you mean, like, if I cook the egg, okay?
If you cook it, that's okay.
No, it will lose its biotin. If I
Yeah.
cook it.
Yeah.
If I don't, it will still. The biotin will be there without cooking.
Without cooking, you mean cooking?
Yeah.
Am I right?
Put it in high temperature.
If you put high temperature, nothing happens because you destroyed everything. In uncooked albumin, so it is one of those diseases happens to some guys. Otherwise, you get enough of biotin in some other times. But without that, you face in a long term with a biotin deficiency. And so biotin is involved in energy production, specifically for fast movements in those pathways that you produce lactic acid. So, and you might hear some of those shampoos, they mentioning I have biotin in vitamin or E. Mainly they mention on it because it is one of the reasons it is mentioned because of the hair loss is one reason because of this biotin deficiency. Yeah. See, when can you face with that? Have you calculated the number of eggs? You want to calculate that? Next time we put the bodybuilding at the center, the gym, say how many eggs you are going to eat.
Whoa,
20, 10, 12, 20. So, yeah. Would be required to induce efficiencies. 20 a day. No. Yes, that you are not going to eat that. So you have to work for that amount of the eggs. So 20 a day. Folic acid. One of the best recommendation for actually, women during pregnancy, because in case they need more, for dividing the cells, they need more folic acid. And because that is essential. It's not supplement for them. They should take this one. And they have different forms of the folic acid. It is involved in some metabolic pathways, transferring one carbon from the one molecule to other molecule. It is involved in one carbon metabolisms. And they have different forms of that. I'm not going to come. In some cases, in some diseases, you might be suspicious about the either folic acid or B12 deficiency. Why? Because there is a pathway in body, both of them are involved. See, what is this? When we convert homocysteine to methionine, what do we need? Folate or B9, and also B12. So we have no idea which one of them are low. We see that there's some signs. However, we can actually inspect with measuring B12 or folic acid in blood circulation and make sure which one is insufficient. So, folate deficiency, we have some diseases. So, inadequate serum levels because of the increased demand in pregnancy and lactation, or poor absorption. Why? Some diseases related to small intestine, or drugs. What is this drug? Methotrexate. It is an anti-cancer agent. And alcoholism is another reason for shortage of this folic acids. The folic acid that can cause a deficiency reason a few weeks. It takes time to show some, deficiency. In between some weeks it happens. Another disease for that is what? Anemia. Anemia is important. One of the reasons for the anemia is the folic acid deficiency. And you are not going to see the details here. Why? Because you are not familiar with some terms related to, anemias like microcytic, macrocytic, this one. So I'm going to omit this one. I will do some modification on this slide, and I will send you again the shortened form of this. Anemia classification, I'm not going to, and some other diseases related to folic acid. What is that? Spina bifida. See, this kid has some bumps on the neuronal tubes. It is because of the folic acid deficiency. It seems, or we can actually say, we had a fluid deficiency during pregnancy. It happens like this. So all month they have it. They have no choice to get enough folic acid. And I'm not going to explain those things because I explained them. And this one, B12. After B9 or folic acid, another important is B12. Some diseases related to B9 same to B12, like anemia, some diseases related to neuronal tubes deficiency. Yes, they are same in some sign because both of them are involved sometimes in same pathways. But main reasons for the B12 deficiency, you might hear some other names like cobalamin. Cobalamin. Because this is structure, we have a cobalt here, and this is an amine, and we call it cobalamin. And so we have B12 in animal resources. So mainly deficiency happens in what type of person? Vegetarian. How long it takes to happen? You need at least 6 months as a vegetarian because we have enough storage for 6 months for B12. It doesn't show its deficiency instantly. For a long term, being a vegetarian shows B12. Because we have B12s in eggs, in dairy products, and so if you avoid all of these things, you be a pure vegetarian, even none of this meat, dairy products, or so yeah. We have some diseases. They are linked to B12 deficiency. B12 absorption is complicated. When we eat some foods containing B12, one factor in the stomach bonds to that. And then in our intestine, another factor bonds to the previous ones and absorb that one. So we have some diseases like some patients, they don't have that factor in their stomach. So they can capture this B12. Without capturing that, you will miss that. And some patients, they have that factor there. This is called intrinsic factor. By our stomach cells actually capture that B12. And then goes to the intestine. In the intestine, we have another factor bound to that one. So some patients, they don't have intrinsic factor in the stomach. Some others, they don't have other factors in their intestine, and they can absorb B12. This disease could be main reason for this kind of patients. They should take B12 how? By injection. They can consume that because their digestive system can absorb them. And they should take that B12 by IV injection. So that disease is called pernicious anemia. Pernicious anemia, this is the process of that in digestive system. See, we have intrinsic factor, IF is intrinsic factor, bounds to the B12, and in the intestine we have another factor bounds to this intrinsic factor and absorbing intestinal or mucosal cells in lumen. And this kind of disease is called what kind? The name here, pernicious anemia. I'm looking for the pernicious anemia term. Why I can't find this? Yeah, this one. I'm going to show you the exact terms of it. Pernicious anemia. It is so severe forms of anemia. You will see neuropsychiatric symptoms. Neuropsychiatric, that's so important. And we have the types of the anemia. The number of the blood cells are low because we don't have dividing the cells, like folic acid deficiency. And same to previous one, we have a B12 and folic acid in same pathway. Because of that, some signs of the deficiency for B12 with folic acids, they are same. Because they are involved in same pathways. Yeah. And again, I missed this one. I'm gonna skip this one. So, what is the monthly injection of B12? Is there a treatment for the pernicious anemia or nasal gel? We have these different types of the new treatment, and we have some mega doses of the this vitamin B12 supplement works even in absence of intrinsic factors. What is the percentage of the uptake? It's not. It seems you give that hundreds of the molecules of B12, you just get one. Just in mega dose situation. So if you have money to pay for this B12 mega dose, go for intrinsic factor disease. That's a recommendation. So folic acid supplement can partially reverse hematological abnormalities of B12 deficiency and therefore enhance equivalent deficiency. All the way from vitamin C. unfortunately, we don't have the last enzyme for synthesizing this. We have many pathways to synthesize the vitamin C, except the last two enzymes. We synthesize until there, but for the last two steps, we don't have enzyme. And so, but because of that, that is essential for us. We have to take that one, and that is involved in collagen. Synthesizing collagen is everywhere. Everywhere that you look, 25% of all human proteins are collagen.
Yes.
And vitamin C is essential for that, and also main process. Main outsource antioxidant reagent and essential for some enzyme. You know what's the disease for that? Scurvy. Scurvy happens in youngs or adults. Scurvy. And what is the soluble? We are going to see that. So I'm going to explain the differences. So this is a collagen synthesis. I mentioned that one. You studied in protein structure. Am I right? In
Yes.
collagen.
Yes.
This vitamin C is involved there, and we had a disease related to that one. And the scurvy actually are characterized by skin changes, fragility of blood capability, gum decay, tooth loss, bone fracture, and anemia. A lot of signs you can see in the scurvy. And I'm going to skip this one. And is the last one here. But I should have my another definition for sorry, what was I have omitted that one. Might be yeah. What's the difference between the stomalagia and stomalagia happens mainly when you are adult. But scurvy, it happens in any stage of life. Yeah, it depends on the level of the calcium, the level of the vitamin C that you have, and so low level of that, because this vitamin C is involved in some other pathways, like collagen. We have collagen in bones and in skin, in cell membranes everywhere. Mainly, that is involved with the calcium in stomalagia. Specifically, happens when the level of the calcium is low. But we will go for that. What is the stomalagia? So it was a story, and I'm going to go to the lipid. So where is that? I'm not going to let you go away because it takes more than 30 minutes. 30 minutes you write.
Say we have a break for 2 minutes. We'll come back after 6 minutes.
That makes sense.
You did something so
No, I
great
guarantee.
for your classmate.